8 medications that can cause dementia. Shocking truth. Did you know that the very medications prescribed to improve your health could be silently damaging your brain? Studies show that nearly 70% of people with dementia are taking at least one medication linked to cognitive decline. What if the pills in your cabinet are putting you at risk? Today, we'll uncover the 8 medications that could be harming your brain and what you can do about it. Imagine this. You're in your 50s, and you start forgetting appointments, struggling to find the right words, or feeling mentally foggy. You brush it off as just getting older. But what if it's something more? Dementia is a growing concern, affecting over 55 million people worldwide. But here's the shocking truth. Some of the medications you're taking right now could be contributing to cognitive decline. Be sure to watch till the end, as we'll go into the science, uncover the risks, and, of course, suggest natural solutions, as we always do on this channel. Before we name these medications, let's talk about something important. It's okay to question your doctor. Doctors are incredible. They save lives, manage chronic conditions, and guide us through health challenges. But here's the reality. They're humans, and they don't know everything. Medications can have side effects, and sometimes those side effects aren't fully understood or communicated. If you feel like a medication is causing adverse effects, it's okay to speak up. It's okay to get a second opinion. Your health is your responsibility, and being proactive could save your brain. Now, let's address the elephant in the room. Why are doctors prescribing medications that could harm your brain? Is it ignorance, or is something more alarming at play? Let's look at the facts. The dark side of prescription practices. How is it that the doctors we trust with our lives are prescribing medications that could be slowly destroying our brains? Do they not know the risks, or is something more alarming at play? Unfortunately, there have been cases where doctors prescribed medications for financial gain, not patient health, and I think it's important to explore this further, so let's look at a few examples. Insys Therapeutics scandal, 2019. Executives were convicted for bribing doctors to prescribe Subsize, a highly addictive fentanyl-based painkiller, often for off-label uses. Doctors were paid speaking fees and perks to push this dangerous drug. Dr. Joel Smithers case, 2019. This doctor was sentenced to 40 years in prison for running a pill mill, prescribing over 500,000 doses of opioids in exchange for cash payments. GlaxoSmithKline settlement, 2012. The company paid $3 billion for illegally promoting drugs like Paxil and Wellbutrin, including paying kickbacks to doctors to prescribe them. Novartis Pharmaceuticals settlement, 2020. Novartis paid over $642 million for paying kickbacks to doctors to prescribe drugs like Lotrel and Valterna. These cases are shocking, but they highlight a disturbing truth. The pharmaceutical industry isn't always looking out for your best interests. That's why it's so important to stay informed and ask questions about the medications you're taking. Now, let's talk about the medications linked to cognitive decline. Studies show that taking 5 or more medications increases the risk of cognitive impairment by 47%. And for those over 75, excessive polypharmacy, more than 10 drugs, is directly linked to a decline in cognitive function. But it's not just about the number of pills, it's about the type. Here are the 8 medications most commonly linked to dementia. Number 1. Anticholinergics. These drugs block acetylcholine, a neurotransmitter crucial for memory. Common examples include certain antidepressants, antipsychotics, and medications for urinary incontinence. Research shows that long-term use increases the risk of mild cognitive impairment by 47%. Number 2. Benzodiazepines. Used for anxiety and insomnia, drugs like Xanax and Valium can impair memory formation. They dampen activity in brain areas responsible for transferring short-term to long-term memory. Number 3. Anti-seizure drugs. Medications like gabapentin and valproic acid, used for nerve pain and mood disorders, can affect cognitive function over time. For example, these drugs might cause issues with memory, concentration, or thinking clearly. It's important to monitor these changes and talk to a doctor if they happen. Number 4. Opioids. While effective for pain management, opioids like oxycodone can impair short-term memory. These medications can also lead to more serious cognitive issues over time. For instance, long-term use of opioids has been linked to a higher risk of developing dementia and other memory-related problems. It's crucial to consider these potential side effects and discuss them with a healthcare professional when using opioids for chronic pain. Number 5. Corticosteroids. Drugs like prednisone, used for inflammation, can cause delirium, mood changes, and even psychotic symptoms. In some cases, these cognitive changes can be severe and long-lasting, potentially leading to difficulties in daily functioning and overall quality of life. Additionally, high doses or prolonged use of corticosteroids may increase the risk of developing conditions such as steroid-induced psychosis or mood disorders. Number 6. Chemotherapy drugs. Chemobrain is a well-documented condition affecting attention, memory, and executive function in cancer patients. These cognitive effects can be particularly challenging, as they may impact a patient's ability to work, manage daily tasks, and maintain social relationships. Additionally, the cognitive impairment can persist long after treatment has ended, making it a significant concern for long-term quality of life. Number 7. Statins. While beneficial for heart health, some studies suggest statins may cause mental slowing and memory problems in certain individuals. These cognitive side effects can vary in severity, potentially leading to issues with daily activities such as remembering appointments, managing tasks, and maintaining focus. In some cases, these effects can be significant enough to impact overall cognitive function and quality of life, particularly in older adults. And lastly, number 8, proton pump inhibitors, PPIs. Long-term use of PPIs for acid reflux can interfere with vitamin B12 absorption, potentially impacting brain health. This vitamin deficiency might lead to problems such as memory loss, confusion, and difficulty concentrating. As a result, maintaining proper vitamin levels is essential for those using PPIs to ensure their cognitive functions are not adversely affected. The good news? You're not powerless. On this channel, we don't just highlight the problems, we also offer solutions. So, here's what you can do to protect your brain. Medication reviews. Schedule regular medication reviews with your doctor. If you're taking 5 or more medications, it's time to reassess. Natural alternatives. Explore non-medication options for managing conditions like anxiety, insomnia, and pain. For example, cognitive behavioral therapy, CBT, can be as effective as benzodiazepines for anxiety. Lifestyle changes. Exercise. 30 minutes of moderate exercise most days can boost brain health. Diet. Focus on a brain-healthy diet rich in fruits, vegetables, whole grains, and omega-3 fatty acids. Sleep. Aim for 7 or 8 hours of quality sleep each night. Mental stimulation. Engage in puzzles, reading, or learning new skills to keep your brain sharp. Supplements. Consider supplements like omega-3s, B vitamins, and phosphatidylserine, but always consult your doctor first. Your brain is your most valuable asset. Don't wait until it's too late to take action. Start by reviewing your medications, talking to your doctor, and making small changes to support your cognitive health. Now, we'd love to hear from you. Do you have any personal experiences with any of these medications? Did any of them surprise you? Let us know in the comments below. If you got any value out of today's video, then please do us a favor and like the video, share, and subscribe to our channel. Turn on bell notifications so you never miss a new video that could help improve your health and the health of those you care about. Together, we can take control of our brain health and reduce the risk of dementia. Speaking of videos that could improve your health, want to learn more about protecting your brain? Here's our next video on natural ways to boost cognitive function on the screen for you to watch. Just hit play.